Hi everybody, and welcome to the TheraOffice instructional training video on using the CoInsurance and Deductible calculator. This is a new tool with TheraOffice. It came with the 2009.1.0.22 version, and it's basically just a tool to help you determine or estimate the patient's responsibility at check-in. So if the patient has a deductible or a coinsurance, you'll know what that should be while you go to check the patient in, and then you can collect that like you do a copay. That way you don't have to bill the patient after they've been seen for their coinsurance or deductible. You can collect that up front and know basically what that should be up front. There's a few different methods that TheraOffice can use to determine or estimate what the patient's responsibility is going to be, and we'll go through them in this video. The first method is really to use predetermined amounts from your administrator program to determine what the patient's responsibility is going to be, just based off of those amounts. So let's take a look in the administrator program where we've set those amounts up. So I'm going to go to location, and then from there I'm going to go to disciplines. And here you're going to see a list of the different disciplines that your facility may treat for. These may either be enabled or disabled, but next to each discipline you're going to see two amounts. These are the allowed amounts. It's basically the standard amount, or sort of an average amount that you would collect from the insurance for things like an evaluation visit or a standard follow-up visit. So you see I have $150 here as my allowed amount for an evaluation visit. You can change that to whatever it should actually be, but $150 is pretty good there. So when you go to check the patient in for the first time, it will use this amount as the allowed amount and then try to calculate the patient's coinsurance based on that. So we'll get to there in just a moment, but then you can also see you've got your follow-up visit allowed amount. So this is for the next visit, the follow-up visit, any visit after the initial evaluation. So let's get into the schedule, and I'm just going to right-click on Sally, and then we're going to go to View Patient Navigator, and that'll open up her file. From here I can go to Current Case to open up her case information. If I go to her Payer tab, that's where I can verify her insurance. And you see in this screen I've already set her up with a 20% coinsurance. So that's what she's going to have to pay, is 20% of the allowable amount. So when I go to check her in, if I just right click and go to checked in, I'm going to get her check-in screen, and it's going to show me the amount that she should owe for that visit. And I can see right next to this it's showing me standard evaluation allowed amount. When I click the ellipsis next to that amount, you can see how that amount was determined. See, basically, because we don't have any other data in here for this patient, it's using the standard evaluation visit allowed amount. That's the amount that was in the administrator that we just looked at, and that's $150. And because this patient has a 20% coinsurance, that calculated 20% of the $150 and gave me $30. So now I can apply $30 to this patient's coinsurance or deductible, all right from here, just like I would as if I was doing a copay. Now I'm going to not actually apply any money. I'm just going to click OK, and that'll check the patient in. Then I'm going to go to the next visit on Monday, January 2nd here, and I'll right click on her and check her in for this visit, her first follow-up visit. So when I go to do that, you see I still don't have any data in there for the patient. I don't have any charges or payments yet. So what the software is doing is trying to figure out what the patient's responsibility should be based on the amounts in the administrator. So right now it's using the follow-up allowed amount, and when I click the ellipsis there, you can see it's using that standard follow-up visit allowed amount, which we have set in the administrator as $100. So 20% of 100 is going to be 20. So we're going to collect $20 from the patient for that day's visit. Next, what we're going to do is get into something a little bit more complex. We're going to look at how TheraOffice is actually going to be able to calculate coinsurance based on other visits in the patient's case. Okay, now we're going to go through the process of estimating the patient's responsibility based on previous visits that already have charges. So what I've done is I've set up Sally with 2 past visits, one on the 28th and one on the 29th, and I've set her up for a current visit for the 30th. I've put in charges in the accounting program for both the 28th and the 29th. So now, when I go to check Sally in for this 3rd visit, it's going to calculate the coinsurance based on the charges from the most recent visit. When I click the ellipsis next to this amount, you can see it'll actually show me the charges that I had for that most recent visit. So I had 2 charges there, and what it's doing is it's evaluating, it's calculating what the percentage should be for each individual charge. So if the patient has a 20% coinsurance, it will look at this charge amount, the total charge amount, and then try to evaluate what the coinsurance should be based on that allowed amount. So for example, in this case, for this code, 20% of $55 is going to be $11. So that would be the patient's responsibility according to that formula. For this next one, you can see I've got a $75 charge. 20% of 75 is going to be 15, and that's adding up to give me a $26 responsibility. So now that can be collected from the patient just like we would a copay. Now you may have also noticed that when I was in this ellipsis, this was automatically set to use the most recent visit because I've got 2 previous visits in there for that patient. But let's say that the most recent visit is probably not the best one to calculate what our coinsurance should be. Maybe the last visit had some other services in it that are not typically performed. In that case, we may want to look to another visit. So I can choose that radio button and then pick a different visit to calculate my charges for the coinsurance. So I put this back to the initial evaluation visit. You can see that there are different charges. So I've got an evaluation code in there, and it's calculating the coinsurance for that evaluation code along with those other 2 codes. And instead of having a smaller balance like I did with the most recent visit, it's giving me a $56 patient balance or patient responsibility. So I can collect that in the same way. Now we're going to go through the process of actually calculating what the coinsurance should be based on visits that actually have payments applied to them. Okay, now we're going to go through the process of calculating the patient responsibility based on previous visits for that patient that already have payment applied to them. And this is really the most accurate way to calculate patient responsibility because you already know specifically what you're going to receive for certain charges based on payments that you've already received. So it makes it easy for the system to be able to look at what that allowed amount was according to the insurance and then calculate the patient's responsibility based on that. So, for example, I've got a visit in here for Sally on the 28th. Also got a visit on there for her for the 29th. Both visits have charges, and both visits also have payments. So now, when I go to check her in for today's visit, it's going to give me the patient responsibility based on the payments that were applied to that most recent visit. And when I click the ellipsis there, you can see the codes from the most recent visit. You can see those allowed amounts. See, unlike the previous example, the allowed amounts don't match up with the totals. They're not the same. This is actually showing me what was collected from the insurance, what the insurance allows. So that's giving me these totals, and then we're basing our patient responsibility off of that, off of what the allowed amount is. So 20% of 42 would be $840. 20% of 54 is going to be $1080. and that's adding up to $19.20, so that's what I would want to collect for the patient for that day's service. Next, we're going to go through the process of estimating the patient's coinsurance and deductible based on another patient that has the same insurance. Okay, now we're going to take a look at this other patient that I've created. I've named him John Finch. Now, John Finch already has a couple visits in accounting that have charges. So we have an idea of what John's charges are going to be for today's visit. But we haven't received any payment for John yet. So we don't really know what the allowed amount is going to be. But because Sally has the same insurance as John, we can look to her account to see if she has some of the same codes that John would, and then we can take a look at what the insurance has already paid for Sally, and then use that to determine what John's responsibility is going to be. So when I go to check John in, we'll get the estimated coinsurance based on his most recent visit. So we can actually see the two charges from his most recent visit in here. And you see over here it's telling you where that was retrieved from. And that was retrieved from another patient with the same insurance. In this case that was Sally. So it's actually looking at Sally's account and looking what was paid for her for those two visits, for those two charges. And then it's calculating the coinsurance for John based on what it was for Sally. So it's given us those amounts, added up, that's $19.20. So now we can collect $19.20 from John, and we can be pretty sure that that is what John's responsibility would be for that visit. So even if we don't have payments for a patient, when we go to check them in, even if we don't know what the allowed amount is going to be, their office is going to take that extra step and look at another patient to compare the two, and then try to estimate the coinsurance based on payments that have already been received for a patient with the same insurance. Now what we're going to do is really quickly just look at how their office will be able to calculate your coinsurance based on your contracted fee schedules. Okay, now we're going to take a look at calculating the patient's responsibility based on the contracted fee schedule for that patient's insurance. So you see I have John on my screen right now, John Finch. I've set John up with a new insurance. I've set that insurance up with a fee schedule. Within the fee schedule you can put in the allowed amount. You can put in the amount that you actually expect to receive from the insurance. So when you go to check that patient in, it can actually look at the contracted fee schedule allowed amount. So while I may charge one amount, like $55 for this code, I can know from my fee schedule that I should only expect to receive $29.69. So based on that allowed amount, it can calculate 20% of that and then give me the patient responsibility based on that calculation. So it's giving me 20% for this allowed amount, 20% for this allowed amount, adding that up to $11.56. And that's what I would collect for the patient from that. So that's another way of calculating the patient's coinsurance. There's one more way that I'm going to show you, and that's how you can calculate the coinsurance based on the actual charges for that date of service.